I don't think that's the vast majority, certainly from what I've experienced so far in Australia. I think that people are really excited about implementing the technology, and I think people are really interested to see, exactly where it's going to end up as well. But from what I've seen so far, everyone's very excited about it.
If you go into anesthesiologist, you have to use ultrasound. They teach you that in your medical procedure, in your residency. There's no question where you're going to use it or not. We have private practices. We have no continuous educational program. So we can choose whether we're going to use it or not. And that's also a bit more difficult, I think.
Yeah. What about you, Stuart?
That's the thing. It's a tool. And it doesn't necessarily have to be used in the same way for every single person. But if you have the tool, you have the option. You have the option if you want to have a look and see if there's a vessel there, if there's some filler that you want to dissolve, you have the option. So I think it's a useful tool. And I think that it probably will become the standard in the future. And I think that some people will use it for every single patient. And then there's going to be some people who will just use it sometimes and for certain things. So I think that's the thing with ultrasound. You don't have to take it on and do it a particular way, especially at the moment. But I think it is a very useful tool for a lot of different things. And people are going to find, there's still people that are going to find their own ways of using it. So I think that's still developing.
What's your experience when you go into an Australian clinic, Stuart? Do you find the doctors, I mean, presumably if they've invited you in, they're keen, but
yeah,
have you found, people who are kind of like, oh, this is a bit silly. I don't think that this is for me.
I haven't come across it yet. I'm sure there probably are people out there that think exactly that. And I think with anything that's new that comes along, you're always going to get a certain percentage of people who are never going to use this technology. They're just not, like you say, they've been doing their own thing for a very long time, and it's just going to be too difficult for them to change what they're already doing. I don't think that's the vast majority, certainly from what I've experienced so far in Australia. I think that people are really excited about implementing the technology, and I think people are really interested to see, exactly where it's going to end up as well. But from what I've seen so far, everyone's very excited about it.
It's something that sort of plagues all of our sciences, I think, is a lot of this dogma. When you look through our medical history, I mean, I'm not a doctor, I've said this all the time, but I study it a lot and look at the history of it. The guy that sort of theorized germ theory many years ago, they put him in a mental asylum because they thought he was crazy. Doctors used to recommend smoking to people. I mean, so the things that we think we know today, we'll find out that we were so wrong in a very short space of time, because things are moving and continually changing all the time, which is why I think these sort of communication channels that we have on people that are brave enough to be pioneers in these areas, that we're able to get this message out and educate people rather than just hearing one voice.
Thanks so much for watching the video. If you want to listen to the whole podcast, go to your favorite podcast app and search for Inside Aesthetics.
If you like the videos we're putting out, please consider subscribing to our channel. Give us a like, smash the bell icon so that you get notified when we put out more content.
If you'd like to support us, our Patreon link is down below, and you can also follow us on Instagram on our personal accounts.